Thanks for taking the time to educate yourself about Empower Healthcare Dietitian services. This video will tell you about the scope of our practice, the unique value of our service, and when it is appropriate to refer to our services. Dietitians are healthcare professionals who specialize in food and nutrition. Their primary role is to assess an individual's nutritional needs based on medical history, current health conditions, and lifestyle factors. They develop personalized meal plans to help manage or prevent chronic diseases such as diabetes, heart disease, and obesity. In addition to providing one-on-one counseling, dietitians also educate the person and their community on healthy eating habits and nutrition. They also collaborate with doctors and other healthcare providers to support overall person-centered care. And through their expertise, dietitians help to improve quality of life, manage symptoms, and promote long-term health and well-being. Next, let's discuss when it is appropriate to refer someone to a dietitian and why it matters. As noted, dietitians are qualified health professionals. We help people improve their health and well-being through food and nutrition. We don't just deal with weight. We support people with medical conditions, disability, mental health concerns, and those with feeding or swallowing difficulties. Some common signs that a referral might be needed include unexpected weight loss or gain, poor appetite or difficulty eating, ongoing bowel or digestive problems such as ongoing constipations, diarrhea, bloating or gas, swallowing or chewing issues, needing tube feeding or supplements, managing chronic conditions such as diabetes, heart disease, kidney disease, cancer, respiratory disorder, liver disease, and among many others, food allergies or intolerance, as well as complex dietary needs due to culture, religion, disability, or mental health. As dietitians, we play a key role in preventing malnutrition, promoting independence, and tailoring advice to each individual's unique needs and goals. If you're ever unsure, it's better to refer. We can always access and provide guidance, even if it's just short-term support. Timely referral to a dietitian is really important and often makes the difference between a simple nutrition solution and a much more complex issues down the track. When we refer early, we can address nutritional needs and helps people maintain their strength, energy levels, and functional ability. This is not only support physical health, but also enhances emotional well-being, allowing individuals to live more independently and with a higher quality of life. And identify risks early, whether that's a poor appetite, swallowing concern, or unsafe eating behaviors. Addressing these issues early also support client safety, dignity, and overall quality of life. When clients receive support at the right time, it fosters a sense of being heard and cared for. These timely interventions build trust, encourage engagement, and strengthen the therapeutic relationships between clients and care teams. Early referral also allows dietitians to provide personalized support that align with the individual's unique needs, preference, and circumstances. In addition, early interventions helps to maintain optimal nutritional health, preventing unintentional weight loss, nutrient deficiency, and related complications. Early dietary support can also enhance the effectiveness of medical treatments, reduce side effects, and promote faster recovery. By preventing malnutrition and managing nutrition-related risks proactively, dietitians can help reduce avoidable hospital admissions and minimize the risk of complications such as infections, pressure injuries, or delayed wound healing. Proactive intervention can also reduce the need for intensive medical treatments, emergency care, or prolonged hospital stays. When we carry out a nutrition assessment, we're really taking a full picture at someone's health and lifestyles to understand how best to support their nutrition. We start by looking at their medical history, then we consider their social background such as who they live with, their level of independence, and lifestyle factors like smoking or alcohol. We also review their weight and weight history to spot on any changes that might suggest nutritional risks. Biochemistry, like recent blood tests, give us some extra clues about things like vitamin deficiency or how well a condition is being managed. We also look about clinical signs, how their appetite is, any nausea or gut issues, and whether they are having any trouble chewing or swallowing. And from there, we dive into their usual eating habits, looking at meals, snacks, food preferences, and food intake. And most importantly, we talk about their goals, what they would like to achieve or improve. All of these help us to put together a plan that's practical, personalized, and meaningful for them. We work within the constraints of what the individual needs, medically and physically, assessing whether their current intake meets the energy and protein, as well as micronutrients requirement. Once a comprehensive dietitian assessment is completed, a number of tailored recommendations may be made based on the individual needs, health conditions, and functional abilities. We begin by providing personalized educations to help the person better understanding their nutritional needs. These might involve guidance on specific health conditions, reading food labels, or managing chronic diseases symptoms through diet. We also work closely with the person to develop a realistic and nutritious meal and snack plans that are suited to their preferences, routine, and health goals. For individuals with difficulty meeting their energy and protein needs through food alone, we may recommend supplements like ensure or cystogen. We also work with the GP to ensure medical approval and integrations with other care. And if someone has swallowing difficulties, a speech pathologist may make recommendations on texture or fluid modifications according to the ITSE standards, and dietitians can provide nutritional support and educations to ensure the person is still meeting their nutritional requirement. We educate individual and the support network on how to manage specific dietary conditions, such as diabetes, celiac disease, and renal conditions, helping them to make informed decisions about food and health. Where people having difficulty assessing or preparing meals, we may provide capacity building strategies and educations to build and develop their skills. Recommended supports such as Meals on Wheels, community support, or support worker to assist with shopping and cooking. We work collaboratively with the person to set clear, realistic, and measurable nutrition goals such as weight maintenance, improve energy, or increase vegetable intakes based on the priorities. Ongoing follow-up is crucial to evaluate progress, adjust the plan as needed, and respond to any changes in medical status or support needs. These ensure continuity, long-term success, and review frequencies will be personalized to the person and their specific goals and requirements. Ultimately, our goal is to support the person's independence, prevent malnutrition, and enhance overall quality of life through practical and person-centered nutritional care. Let me quickly walk you through our referral process. It's designed to be simple and efficient. We have an easy-to-use online referral form that takes just a few minutes to complete. It collects all the essential information we need so we can get started with supporting your client as soon as possible. There's also helpful features that allows you to save and return to a partially completed form in case you need more time or additional details before submitting. Once the referral is submitted, you'll receive an acknowledgement email with a full copy of everything you provided, so you have it for your records.